In Guizhou, a distressing incident unfolded as a 6-year-old child became inadvertently affected with what is known as a brain-eating worm. On June 26, Miao, the child's mother, shared the heartbreaking experience, recounting how her child developed a persistent high fever for over 10 days after swimming in the sea during their visit to Hainan at the beginning of June. Despite seeking treatment at multiple hospitals, the child's condition worsened, ultimately requiring admission to the intensive care unit. By June 21st, the hospital had diagnosed the pediatric patient with acute purulent meningitis characterized by symptoms such as convulsions, central respiratory failure, and bronchial pneumonia. The hospital issued a notice stating that the child's condition was critical and could deteriorate any moment, putting their life at risk. She wrote about the baby's condition on social media so other mothers could be vigilant and proactively prevent their children. As of 11 a.m. on June 26, the patient was still undergoing treatment with their condition showing no improvement. Recently, another incident involved the infection of a 15-year-old boy named Awin with Balahiamoeba baboon, resulting in his death. Awin, a native of Guizhou, frequently swam in the local ponds and rivers. In December 2018, he experienced nasal pain, and on May 23, 2019, he developed a fever. Seeking medical attention on June 2nd, Awin visited Huashan Hospital, where tests confirmed his infection with Balahiamoeba baboon. Despite attempts to save him, Awin passed away on June 9th. Additionally, on August 14, 2016, a 43-year-old man in Shenzhen began experiencing headaches and coughing after participating in water activities at a scenic location. Tragically, he died just 2 weeks later. Official testing confirmed that he had contracted amoebic meningitis. Dr. Huang Lisu, the head of the infectious disease department at Zhejiang University Children's Hospital, said, "Amoebic brain infections are sporadic, with a mortality rate of up to 90%. Between 1962 and 2021, the United States reported 154 infections, and only 4 individuals survived. Successful treatment of amoebic infections, especially in children, is infrequent." So, what exactly is an amoeba infection, and is it truly a brain worm? According to Dr. Huang Lisu, a chief physician and director of the Department of Infections at Zhejiang University Children's Hospital, amoebas are rare parasites primarily found in tropical and subtropical regions, inhabiting water, soil, and decomposing organic matter. Amoebic infections can be classified in 2 categories, skin and brain. The parasites can enter the human body through 2 primary routes. Firstly, farmers become infected during agricultural activities when the parasite penetrates the skin, lending to the persistent and challenging to treat erythema. Once the parasite reaches the brain tissue, the chances of a successful cure are relatively low if left untreated for an extended period. Secondly, individuals can be infected with brain worms when they swim in rivers, lakes, and ponds or use contaminated water to rinse their nasal cavities. The parasites then enter the human brain through the nasal cavity, rapidly multiplying, and cause purulent meningitis, vascular hemorrhage, and brain parenchymal necrosis. Amoebic meningitis develops swiftly, progressing from symptoms like headaches, fever, and vomiting, then rapidly turning to paralysis and coma, possibly causing death within a week. Therefore, the amoeba is also known as the brain-eating worm.